Dun dun.
Hey guys, so what is up? It's your girl Mills. Welcome back to Keeping It Wheels with Mills. This is a blueprint to life after a spinal cord injury. This is everything you won't find in a textbook about spinal cord injury.com. So guys, welcome back. And I know it has been a very long time. The last time we spoke was last year. So this is the first podcast of the year. So I'm super excited. Welcome back. I have a new background and I have a new cool couch. So I'm pretty excited about that. So, guys, today we are going to be talking about my experience with my knee injury as a quadriplegic. So, before we begin with the story, guys, let me tell you what I was diagnosed with. Okay, so I tore my PCL and also my medial meniscus, and this happened on October the 3rd of 2020. And I know what you guys are thinking. Weird and spooky things always happen to me on October. If you guys are new to my channel, my name is Mills. Welcome. And I initially got injured and became a quadriplegic on October the 4th, 2014. So in that day, I broke my C5 and I became a complete quadriplegic. And throughout the years I was able to regain some movement. I got to the point where I was able to walk with crutches. So that's where I was at. I felt comfortable in my body. I felt confident enough to walk on my own with the crutches, and I had been doing that for a couple of years up until October 2020. So like I mentioned, on October 2020 I fell on my knees, and I'm usually able to tell like when my legs are gonna give up or when I feel weird. But that day they just like gave up on me. Like I felt like I fainted. And ever since then I noticed a weird pain on my right knee. And I didn't want to think much of it. I was like, okay, well maybe I'm tripping and I'm just overthinking it. So I was like, the pain should lessen within the days. So if it gets worse, then I should go to the doctor. If it goes away, then it was nothing. Like it's just bruised or something. And the thing, guys, is that with my spinal cord injury, I don't feel pain right away. I feel it like days later or hours later. So I didn't start to feel discomfort until like maybe the next day. And then after that, I kept on walking with my crutches, but I fell two more times. Like my leg just gave up on me because my knee wasn't stable enough. And sure enough, guys, I was really concerned. So I made a doctor's appointment with my spinal cord injury doctor, and she suggested, we got an x-ray, and we did. And after that, she was like, you know what? I think you should see a knee specialist. I think they'll be able to help you out more. And I guess she didn't want to tell me that something was broken because I don't know. So then she referred me to this doctor. And at first I was pretty excited about it because when I saw his name, he had like a Hispanic last name. And I was like, okay, well, that's exciting. I've never had like a Hispanic Latino doctor. So, it was just something cool. And I was ready, to see what was wrong with my knee. So I walked into the office, and sure enough, I told him what was happening, and he said, okay, well, we should get an MRI to see, what's really going on. So I got the MRI done, and then I went back to him and I explained to him, and I showed him videos like, hey, I used to walk, like I was doing pretty well. So, I want to get it fixed so we can, start with my recovery again, right? And so after we got the MRI, guys, he mentioned that I had torn my PCL and my meniscus, right? And I was very afraid and just sad because I knew that required some kind of surgery, right? And I knew that I was going to have a setback. But he just didn't want to do the surgery for me. Like he recommended therapy. And at first I was like, okay, well, he knows what he's doing. He's a doctor, right? And I agreed with the recommendations he gave me. I did therapy for like 2 to 3 months, and I noticed that the pain wasn't going away. So then I reached out to one of my therapists, my old therapist, Marlon. He actually has his own practice now. So if you guys are here in Houston or in the Baytown location, Pasadena, like make sure you check him out. I actually don't go to him right now with my knee injury, my recovery, because it's too far and I don't want to make my mom drive that way. But if you guys are around that area, I would definitely recommend him. He's like a really, really good therapist. But anyways, back to my story. I sent him a DM on Instagram because I still remained in contact with him because like I said, he's real cool and I trust him. So I was like, hey, like this is what has been going on. The pain hasn't gone away. What do you think I should do, right? And he was like, oh no, you need surgery. Like, no kind of therapy is going to fix your PCO or your torn meniscus. And I was kind of like, wait, are you serious? And after that, I went to my next appointment with the same doctor, Dr. Flores, and he was just very hesitant about doing this surgery with me. Doing the surgery for me, he just, it was the first time I felt discriminated, honestly. He didn't want to do the surgery on me because I'm disabled. I'm a quadriplegic. And we talked about, like, I'm going to go ahead and read you the notes. And the thing is that I feel like he gaslighted me. And he was just like, no, I think you got this injury, the day of your accident. And, the thing that like makes me mad now is that I actually thought about it. I was like, oh my God, like, what if I did get it that day? What if I did get injured that day of my accident, right? And it just, within the years, it just got worse and worse and worse. But that's not the case because my knee never hurt before. Like, I was able to walk independently with that knee. So I just kind of felt like he kept on going to my initial injury, and that just wasn't the case. So let me go ahead and read you like his notes. And one of the times that I went to him, because I went to him like several times, and I just kind of felt like I was wasting my money, like my time, money like in co-pays and parking, and I was calling days off of work. Not that I enjoy my job, but still, what if I liked my job? Like I kept on calling in because I needed to go see him, right? So let me go ahead, like I said, and read you the notes. I saw and evaluated the patient. I reviewed the resident's note and agreed, except I had a long discussion today with Mildred regarding her knee condition. Exam-wise, she appears to have a chronic PCL deficiency. Imaging-wise, she has evidence of the medial meniscus or root tear the previously seen. Her PCL does appear somewhat situated on her MRI, although exam-wise that she has grade 3 posterior drawer. We discussed these two injuries that tend to happen together. I believe it's her most likely chronic dating back to her original car accident. Unclear why she complains are more significant since October. Again, concern for her underlying spinal cord injury and incomplete picture. Would recommend she continue with strengthening, although due to the spine issue, will not be able to fully regain quad strength, which would help with the PCL issue. We discussed surgery is unpredictable and potentially could make her worse. We will have her follow up in about 3 months' time and repeat for discussion. This was on July the 22nd, and after that, I never went back to him, guys. Like I said, I feel like I was wasting my time, and he even mentioned one time that because I wasn't normal, he was unsure about how my recovery would look. And I am so glad that I didn't take no for an answer, and I went looking for other doctors. I actually got 2 more no's, and wasting my time there with co-pays and parking and just my time in general. And one of the doctors actually put a steroid shot on my knee, and it didn't work, guys. It only lasted for like 2 weeks or something. And I told him like, hey, like I can't keep doing this. Like I'm very young. I'm not going to come to you every month and get these done because I'm not going to do that. Like we need to fix it, right? After I went to him, Dr. Fullick, he recommended me to go to another doctor. He specialized in knee injuries. So once I went to him, I couldn't even make the appointment because the person in the front desk told me that if I didn't have a sports related injury, he wouldn't see me. So after that, I was kind of like, okay, so what do I do now? And I asked the lady, like, what doctor would you recommend me, to see? Because I need a doctor. So she recommended me 2 other doctors. And, I Googled them, and I actually didn't make that appointment until a week later because I felt very defeated. I felt discriminated. I was like, man, like if I didn't have a spinal cord injury, any doctor would would agree that I need a surgery, right? So it took me like a week. I actually was just thinking about it, like what if I just stay like this? What if I'm not meant to walk? Because I've had so many setbacks, and I kind of feel like every time I feel very strong, something happens. So I was okay. Like I said, I Googled both of the guys, and I liked one guy. Like he's cooler. Like I liked his vibe, and I was like, let me go to him. let's see, let's just see like where this goes, right? And sure enough, like I booked the appointment with him. I was able to see him like a week after that call, and he was very professional. And I would definitely recommend you guys to go to him if you need like, if you have problems with your knee. He's, like I said, he's very professional, courteous. I've never met a doctor like him. Like he's been like the best doctor. He is just awesome. And no, this video is not sponsored, but I will forever, talk great things about Paul Shoop. Once I saw him, he was just kind of in shock. Like, so what you're telling me basically is that you've been trying to get a surgery for a year now after your injury. And I was like, yeah, like it's unbelievable. He was like, yeah, like that's not cool. Like, I don't know why, they wouldn't do this surgery for you. Let me take off my glasses. I will forever be grateful for Dr. Shoop. And even like looking at the notes, like the notes are more caring and compassionate rather than, Dr. Flores. Like he was just gaslighting me. I'll go ahead and show a clip of what gaslighting looks in the medical field. And it's actually like, it's an actual thing. So I'll go ahead and show this TikTok of this girl that I follow. She's hashtag, a Latina doctor, Hispanic. So I don't know. It's just super exciting to see somebody, in the medical field, be successful. And like she looks like me, it's just pretty motivating. But so anyways, I'll go ahead and show the clip. I'll show it right here, so enjoy.
Before I get into these keywords, I want to explain a couple of terms for those who might not know what gaslighting means and what it looks like when it's being done by your doctor. Gaslighting occurs when an individual repeatedly denies somebody's reality in order to dismiss them or to invalidate them. Medical gaslighting occurs when a healthcare provider downplays a patient's concerns. And the following are just some examples. When a provider stereotypes a patient based on their sexuality, gender, race, age, nationality, race, so on. When a provider tells you it's in your head or that you've made it up, by doubting your trustworthiness, by saying that you're reading too much into it or that you are overreacting, downplaying your pain, saying that it's normal when in fact it might not be normal for you, blaming your mental state for the way that you're acting, refusing lab work and imaging. And these are just some of the few ways that providers gaslight their patients. And I'm not making these up. These are actually concerns that patients have brought forth to lawyers who have eventually sued these doctors.
And what sucks is that this happens very often. Like, my people, my disabled people, they get discriminated all the time because doctors don't want to do surgeries on them because they feel like they don't need it. Like, I do need my leg fixed, okay? And it sucks that, I had to go through all of that. I had to deal with that for a whole year to finally get a yes. The recovery itself, guys, was very tough. I know you guys are probably like, Mildred, it took you so long to get the surgery. Now that you have the surgery, why aren't you happy? I was very grateful that I had the surgery and I knew what was coming, right? Because these type of surgeries are very critical for somebody, that has full function, that somebody that doesn't have a spinal cord injury. So I knew it was going to be like way tougher for me because I have a spinal cord injury, and I knew I was going to lose muscle and become weaker. And I did, guys. And the thing is that, we couldn't follow the protocol for a PCL because I also had a meniscus tear, right? So it was very critical. I couldn't just look up videos on YouTube or like Google things because all of them were like, oh, okay, PCL recovery, meniscus recovery. But it was never like both of them together. So it was very critical. And that's why I had to have the brace on locked for like four to 6 weeks. And it was very intense. I went back to using my hospital bed. I went back to using diapers. And I actually wasn't using diapers anymore, guys. I had gotten to the point that, I didn't need them. And it was just very tough. It was very tough for myself, for my family. Because they were just so used to me being independent, and I lost a lot of independence. And it was just kind of like, it took me back to my previous injury, though, when I became a quadriplegic. I was back in my hospital bed, and I was shitting in the diaper. My mom was wiping my butt in bed, I had plenty of accidents. I actually had my first accident in my boyfriend's car, like poop and pee on different days. So it was very humbling, and it kind of sucked because like I've only been with my boyfriend for like a year, right? And I that was my fear ever since I met him. Like, oh my god, I don't want to pee in his car. I don't want to like poop in his car, and it finally happened, and I just felt it was intense, right? But I'm glad I'm not there anymore. And every time, I actually cried for like a whole 2 months nonstop because I had lost my independence. I just kind of feel like I worked so hard not to be here, and now I'm here. Like, it's not fair, right? So if you're watching this, be careful. Like, treat your body like a temple. Never overdo it. Remember that, you're going to need your shoulders till you die. These are now your legs. And, you don't want to, depend on somebody. If you were at a point where you're recovered and you're independent, like, you don't want to lose that again. So always be careful with that. Don't overdo it just for Instagram or, whatever you're into, TikTok. Because I feel like I should have just slowed down a little bit with my working out. I think that day when I fell on October 2020 on my knees, I was just doing too much. Around the time, that's whenever the gyms were closed and everything. And I was just, working on my legs every day because I was bored. And I think that's the reason why my legs gave up. But guys, that is it. I'm now in a better place. I now have my regular bed. I'm not in the hospital bed. I'm still not driving. I'm still going to therapy, and it's going. And I'm not wearing a brace. I only wear it like when I'm standing, walking, because it's not strong enough yet. But just be careful, and I hope you guys learned something from my experience. Know that you're not alone if you've been discriminated by a doctor. It just feels very terrible. Like, oh my god, like, you're a professional and you're telling me I'm not normal. Like, you know how long I've been working on myself, telling me that I'm normal? We had some technical difficulties, guys. I don't know where it stopped, so I'll go ahead and share the script of what Dr. Shoop said about my injury, and to show you how compassionate he was. And before we ended, I just want to put it out there that day of my surgery, I was very nervous, and you could tell that I was nervous. And the thing that got me was that he looked at me and he was like, you know what, you'll be okay. Your family's going to be praying for you. I'll be praying for you. Like, everything's going to be okay. And he explained to my family everything that, he had done in the procedure. So before I end this video, guys, I just want to thank Dr. Shoop. I don't know if you'll ever see this video, but, I'm very thankful that I was able to find him. I can honestly say that this surgery is going to benefit me so much. Like, my leg isn't even strong enough yet, and it feels secure. So I'm glad I didn't listen to Dr. Flores, because my recovery did not worsen. Like, I'm gonna get stronger. I've gained a lot of strength back after the surgery, and I will keep regaining that strength because my cells love me. But guys, thank you so much for watching, for tuning in. I'm very excited that I did this video for you guys. And like I said, I just want to thank my family, my boyfriend, my friends for, keeping me sane throughout this recovery, because it was crucial. Like, I wouldn't go out for shit, guys, because my house isn't accessible. So it was very hard for me to go downstairs, and I would just go downstairs when it was needed, like therapy and doctor's visits. But most of the time, well, actually the whole first 2 months, I would just be at home. I would hang out, like, when I would just hang out at home by myself, with my family, with my friends, with my boyfriend. So I've learned to love my room. And I'm so thankful that I'm not there anymore, guys, and I'm progressing, like I said. So anyways, guys, thank you so much for watching, for tuning in. So if you do stay a little longer, I'm gonna show a little vlog of what it was, these past 2 to 3 months. So hope you guys enjoy that, and let me know what kind of other videos you'll like to see again. So you know how it goes. See ya. Don't wanna be ya.
So he just watched the knee. So.
How are you feeling?
Nervous?
Unas palabras para tu hija.
Dude, I can sign it.
You can make a vlog out of this.
So if we notice, I'm not going to push hard, but she's no longer moving, so the knee is much more stable.
Day 3. Todo.
Okay. Shit, I'm just gonna cut it. Lo corto más, sería mejor que lo cortara la venda.
¿Será?
Pues si en el dólar las venden, ¿no?
No, déjame con el dólar.
Mira, voy a tener que estar así.
Pero
roll y
el
roll.
problema es que no siempre. Como quiera ya va a estar manchada, ¿no?
Pues tiene hoyos, I guess I could. Oh, I'm scared. Restart. This is the main part. 1, 2. ¿No tienes más causas más? ¿Tú no tienes?
A ver,
Híjole. Está bien pegada su sangre.
La sangre.
Ahora no estoy. Dijo el doctor que no me hagas.
What is up, it's your girl Milz. Welcome back to my vlog. And right now, Tony's on the camera. He's recording. I'm hanging out with Tony and with Joshi. And we're just hanging out because of my leg. This is day 3, guys. I took a shower. And this is how my leg looks now. Okay, and Josh over there. He can walk. He's just faking it.
Where's
He's
your
a
man?
faker. Who's your favorite brother?
You have a brother?
He has 2 brothers. Show him more on his face. Zoom it out.
My older one.
The older one? Why? I like the younger brother.
Is he funny?
Yeah, the younger brother is cooler. The older one no me habla. He quiet. I'm like boo.
Sucker. Not trying to be mean, but sucker. Okay, who do you like better, me or Minnie? Millie Mills.
Cool. So
Yes, let's go.
Little toe.
Guys, today is 1 week that I've been crippled. I'm wearing a diaper, and today I was really. It just feels like when I first had my injury. So yeah, I pooped in bed for the first time in 7 years. So I was really sad. So since I was sad, I bought this. Can you see it?
Hold on.
It doesn't hurt as much, but I keep putting ice on it. And yeah, that's the deal. So I'll keep you guys updated, and I'll keep posting, you know, my recovery of my PCL and torn meniscus. Bye. Sorry, I look depressed. You guys probably don't care, but this is how I would poop with my legs straight. And this is me just signing some papers at therapy. This is me at therapy. We would focus a lot in quad strengthening. So these are just leg raises. And the days that I wouldn't go to therapy, of course, my dad, shout out to my dad, he would help me do therapy because he's just the best.
Go.
So this is how I get ready for Thanksgiving. I really like this. So look at my face before, and I look at it after. Can you see the difference? I know
It's
you see
shiny?
the shine, bro.
Oh yeah.
Look at it. I literally look alive now. You can't lie.
Wow.
Nah, like no lie.
No, you do look shiny. I'm not lying.
And then I got this from Michaela, the TikToker. That ¿cómo se llama? Bright Side Illuminating Primer. And it has vitamin C.
I'll zoom in.
But look, my face looks good, bro. That's first. And then we're gonna do.
You know she got engaged?
Who?
Michaela.
Yeah, I saw it. I saw it. And this place is massive. I like her cold, bro.
Yeah.
Alright, so then we're gonna do Elf Putty. And I'm almost out, but it does cover it.
Thomas Bryant is my NBA client, and he's amazing. And
I'm watching Selling Sunset.
house in Woodland Hills because his commute. You guys, this is Thomas.
Can you see my lips?
Yeah. It's right there. Oh, that one?
Yeah.
No.
Why not? Think you shouldn't make it.
No, Thomas.
I mean, you can see some of it.
One more look at
That's her leg, you guys. Right there. That's it. Right there. And then this is her doing her makeup. And that's me over here.
And then, guys, I lost weight. This is
Oh.
my face looks skinnier.
Yes, you look skinny. Like your stomach is literally skinny.
Look at my arms, guys. I look like.
They're tiny. Look at her tiny wrist. And then since your hands are big, it makes your wrist look even smaller.
Alright.
Oh,
stop
can I be
recording.
like you?
I'm literally wearing a diaper, bro.
I meant the skinny part.
Today is Sunday, and I make 3 weeks on this upcoming Wednesday. I'll be able to bend my knee. And I feel okay, I guess. Trying to bend my knee after having it straight for 3 weeks was one of the most uncomfortable feeling I have ever had. And my spasms didn't help at all. Guys, I am on week 8, week 8, and this is what I'm looking like. I can bend my knee now, could weight bear as tolerated. My brace has to be locked if I'm walking. So yes, I am walking like a robot, and it's a slow recovery, and I am happy that I'm progressing. It's been 2 months now, and this is the first time that I took a shower, so that's why I'm recording. I'm really happy. I hadn't been keeping up because I was #depressed. It's been really hard, man. Like, not sleeping in my bed has been depressing. I'm back to my hospital, like I said. I pooped there quite a lot of times and peed because my restroom isn't accessible, so it's hard to be independent with the leg brace, weakness, and everything. But we are on to better things. And week 8, can't wait to be on week 24, where everything will be better and easier and just better. Van a salir en YouTube. So I am starting to feel like myself again. I have these little shocks going on right here. They sent it to me a while back. They were free, and what I really like about them, no, this is not sponsored, but I can wheel around and nothing gets stuck. So that's what I have to have connected. Something's off. I think the battery's off on one of these, but that's what I'm using now. And my room is back to normal. I feel normal. My voice got a little like watery because it's so oh guys, and then I got COVID. Let me tell you, in the middle of my recovery, guys, I got COVID, and then I got a UTI and I still have that annoying cough. I think I still have the UTI, so I'm gonna go to the doctor today. So right here, you're gonna notice that I'm looking a little slim thick, but the only reason why my butt looks big is because I'm wearing a diaper. And let me tell you guys, this was in the winter time, so it was really hard to find pants that fit me with the brace. So I had to wear these like extra large pants to be able to be warm and to wear my brace. So here I am struggling. It was very, very hard, and I look like Kim Kardashian TBH.
Ladies and gentlemen, we are ready to begin.
I'm not going to lift unless you need help, okay?
And then you'll just unlock it.
I won't unlock it. Or lock it.
Lock it once I
Yeah.
They were gonna approve them, but they said
Dun, 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 dun.
Love that music there.
Dun, 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 dun. Good job, Mike.
Alright.
How we looking?
You're telling me I'm doing a good job? She's doing all the work. I'm just sitting there pushing a couple of buttons.
All right, to the family members who are watching this video, pay no attention to my voice.
I swear I gotta work with all day.
You are doing an amazing job.
Yes.
The yellow belt is really complementing the outfit and everything.
So this is where I'm at now, guys. I'm now walking with my forearm crutches and with my PCL brace. It's really easy to walk with this brace, one, because I can bend my knee, and second, because it's really light and it's not bulky like the other brace. So I've been taking it easy, guys, and I've been enjoying the ride because that's the only thing that I can do, really. My fate has been tested a lot these past 3 months, but I've grown a lot from this injury. But it is what it is, guys, and I have to keep going and make the best out of it. So hopefully when we see each other again, I'm doing way better and I'm stronger. And of course, this is to be continued because I'm hoping for the best. So bye, guys. Thank you for watching my video, guys. See ya. Don't wanna be ya.